may take a second.
Okay.
And I'll let you know. And when I see it preparing and it goes down to this one spot, then I'll hit it. So setting up your meeting for Facebook Live. So I think we're going to be there in just a second. And I believe we're there. I think we are. Okay, here we go. Hey, everybody. Happy Wednesday. So glad to be here. Hey, Laura, how you doing?
I am doing absolutely wonderful. It's just wonderful to have a hump day when the sun is shining here in Chicago area. I mean, really, and it's starting to get warm, so let's just hope it's going to keep staying that way. I am so excited today. Debbie, you have found the most wonderful person that we could interview. And I understand that so many people deal with so much pain and everything. And I think that this Angie here, Dr. Angie, should we call you Dr. Angie?
Whatever you like.
Okay, Debbie's going to introduce you to her, and she'll tell you all the amazing things that she does. So
thanks, Lori.
I'm handing it to you.
Thanks, Laura. So I just want to say one thing, that Lori and I, as we've started this group, we have had like all these different ideas of different focuses, and everything's for the health and wellness, and everything is to help benefit people, and everything is to kind of, you know, see if we can find places that we can make connections and network people together. So Lori and I are always looking around us, like who can we, you know, who can we meet, who can we, you know, connect with and stuff like that. We're not shy people by far. And so I had been, you know, scrolling through Facebook, and I had been in some of my, you know, groups that are in my area here in, you know, the Westmont Downers area. And I had come across, you know, Dr. Angie Skokos, that she was doing a few things where she was doing some little videos talking about different focuses. Then she was also putting some of her, you know, information onto local groups. And I found that we had some common friends. And when I found the common friends, I just reached out to her. And so quickly she, you know, responded back, which was wonderful. She's so timely. She's so busy, but she's so timely with answering back. And we invited her to join onto our For the Health and Wellness of You group with her focus, which she will talk about. And now coming forward, I find out that I know some of the kids that her kids go to school with. I know someone who she taught and helped, that I know that was in her, you know, when she was going through, you know, helping and teaching, when she's going to talk about this. And so now it's kind of like, I feel like I've known her for longer than ever. And I did stop and I met her face to face, and I feel like I've known her forever. And Lori and I've talked about it. So what I want to just say is that Dr. Angie has so many accreditations. She has so many things that she does, and she's got such a passion for helping people. I'm not going to go into it, but what's interesting though is that I'm going to let her talk about that, but she's graduated locally from some different schools, and she's brought her education further and further. She didn't just stop at one area, okay? She kept moving on, and you can clearly see that she has a passion to help others. So with that, I'm going to say, Dr. Angie, take it away, and please let us know who you are, what you do, and how you're helping others. We're very interested and intrigued.
Thanks so much, Debbie, for the awesome introduction. Lori, thanks again. Thank you both for having me here. I'm super excited to discuss and let you all know a little bit about myself and how I can help society and people around us. Because let's face it, we're all in need of help one way or another, whether it's healthcare needs, wellness, you name it. You know, we live in a society where we're constantly being bombarded by stress, different factors, you know, whether it's the toxins, the air that we breathe, the poor diet, our work, our stress environment at home, stress environment at school, all these things take a toll on us. So it's very, very important not only to be out of pain. Pain is only a very, very small part of the overall wellness. I mean, when you start suffering from pain, that's the body's indication of something is going on. So the body's starting to whisper or talk to you. Don't let your body get to the point where it's screaming to you when you're in so much discomfort, where you're not able to walk. Let's say clean the house, walk the dog, take care of yourself, or do the things that you love, right? Because pain does have effect on the overall body. So my goal in my office treating patients is, yes, getting them out of pain for the purpose of restoring health and wellness. So they're able to function, carry on their day-to-day activities, play golf, play soccer, go running, go kickboxing, whatever makes you happy. That's my goal, to help our patients. And we always address the patients based on their presentation. Let's face it, we don't have any two patients identical. We have similar anatomy. We could have two females in the office, same anatomical parts, but the internal structure based on the health is quite different. You know, some people have diabetes, some people have cholesterol, some people have headaches, some people have gone through surgery, so you name it. So this is why it's important that we sit down, we talk with the patient, get a complete thorough understanding of their health issue. So I have an understanding, so I know how I can help that person. And if I can't help that patient, I'm going to be upfront and say, I can't help you, go to this person, because I never want to drag along somebody just for the ride, to say, right? You know, I'm here genuinely to help that person. And if I can't help them for whatever reason, I will be open and honest with them. So I've been doing chiropractic. I've been a chiropractor for almost 19 years. I got my earlier education undergrad studies from Benedictine University back in 96. I grew up in Addison, so I commuted to Benedictine in Lisle. I got my degree in Lisle from Benedictine. Then I've always wanted to go into the medical field. I wanted to help people with their health. Okay. I wanted to be a doctor from a little girl. I knew that from a little girl. How did I know that? Because I saw the wonderful things that chiropractic did to my grandmother. She inspired me. You know, she had the low back issue. She couldn't walk. She was on her hands and knees back in the early 80s. Now I remember her. I'm like, why is this woman not able to walk? There's got to be something. And she was going to doctor after doctor after doctor. And they all said, you need surgery, surgery, surgery. Now, back in the early 80s, chiropractic wasn't much of a thing, right? Everything was about popping pills, surgery, medication. And she's like, nope, I'm not going to do the surgery. There's got to be another avenue. So thank goodness she was stubborn in that aspect. We explored chiropractic. She saw this wonderful chiropractor, was about an hour away. I think it was in Lake Bluff at that time. I tagged along with my mom because I was curious. And I wanted to see what this guy was going to do to my grandmother. Because let's face it, me and my grandmother to this day were like this. So I wanted to see what he's going to do to grandma, right? Went in, did needles, acupuncture treatment, as well as the adjustment. For the first time after 2 weeks, she was able to walk.
Wow.
She had tears of joy. So you can imagine how this was taking a toll on her body, right? She couldn't do the things that she loved, taking care of her family, cooking, having everybody over. I mean, my family's all from the old country in Greece. So we're all about family and eating and getting together. So when she couldn't do that, it was really taking a toll on her. And I said, this is what I want to do with people. I want to help these miracles every day.
Oh, that's awesome.
So I went on to chiropractic school, National University of Health Sciences. I studied there. I graduated in 2002. Opened up an office in Addison, continued working. Then I got a position to work back at the chiropractic clinic. So I was working in the clinic, fast forwarding, for about 10 years. I was an associate professor as well as a attending clinician. So I trained a lot of interns who were going through their clinical rotation in the chiropractic program. We saw a number of patients. We helped a number of patients. I trained these interns so they can in turn help people in the society, locally or out of states as well. So then I continued my educational studies, got my Master of Science, Advanced Clinical Practice in 2013. That was my third degree. But along the way, I was doing a lot of, taking a lot of seminars, acupuncture seminars, fire cupping seminars, acupuncture following traditional Chinese medicine, helping the body restore its natural health and wellness. I've incorporated cosmetic acupuncture, facial cut rejuvenation to help, our lifts, right?
Really?
Restoring the health of the skin and the collagen. So we can get into that maybe like another time about the details of that. So, there's a lot of different approaches to health and wellness naturally. That's why I love this field so much, because it's not only about injecting meds or doing surgery. I always tell my friends, family members, and my patients, exhaust the conservative means first. If you truly have tried that and it doesn't work, you can honestly say you've exhausted it and it doesn't work, fine, go the allopathic route. I mean, let's face it, we do need our pain meds. We need it, but we have to be within that limit of, not overdosing on the pain meds. We have this huge opioid crisis, and we have other types of, approaches that we can help deal with the pain with acupuncture, for example, chiropractic, so these are just great alternative means to helping a patient deal with their day-to-day pain and basically live a stronger life. So any questions, ladies?
I gotta say, I love it. I gotta just say one thing and interject, be the best version of who you can be kind of thing is what you're doing and you're saying. But I just love every bit of everything that you're doing, because you're so honest and down to earth. Somebody wouldn't feel intimidated if you told them one way or the other. They would trust you and exhaust all those possibilities. If and if you couldn't get them to the point, like you said, you'd be honest and you'd send them. But based on your education and the vast amount of like arenas that you're in, you're going to pull another kind of thing out of your hat, kind of like, okay, let's use this too and do that. I think that's awesome.
Exactly.
Yeah.
But I always tell the patients, we're a tag team here. We're almost married, I'm going to give my 110% to you as a patient, but I expect the same in return.
Right.
Right. So I can't be doing what I'm doing here in the office and then you're not doing your home exercises, or you're not icing, or you're not taking your supplements. Eventually that's going to take a toll, and we're just going to hit a wall. So if we want to maximize everything, we got to work together. And if there's something the patient doesn't like, I want that patient to tell me, hey doc, I don't want to do this. I don't like this, but I have to, explain to them the purpose of that so they understand why we're doing what we're doing. I never like to use that cookie cutter approach. We use the same treatment for everybody, because again, no two people are the same.
Right.
I may respond to acupuncture, you may respond to chiropractic, or maybe a combination of the two. We just have to see what your clinical findings are. So that's probably a quick overview of what we do here in the office.
Absolutely. Laura, I'm going to send it over to you.
Oh, thanks. Oh, you're amazing, Angie. I'm going to come run to your office right now. Good idea.
Okay. The more the merrier.
I just want to ask you a couple questions. You deal with acupuncture for people with weight loss or people that are dealing with weight issues?
Yes, there are specific points that serve as appetite suppression points. Okay, now the way that the acupuncture works in these cases, we're going to be stimulating points on the ears. It's called auriculotherapy, as well as other points throughout the body, the wrists, the legs, the feet. And people always ask me, well, why are you doing the ears? Why are you doing the wrists? If we're, let's say, targeting the low back as an example, or even the weight loss or the weight suppression, appetite suppression. That's because all these pathways, meridians, they're tied together. They're like going on Route 83 or Ogden Avenue. Okay, so we are trying to free up all the energy so we get proper flow of energy, proper circulation, proper oxygen. Okay, so there's proper flow. So we're able to help the pain, whether it's the pain or help the suppression. In this case, we're talking about the appetite suppression, but they have similar concepts. Whether a person's coming in for balancing or pain control or appetite suppression or quitting smoking, same concept. We want to free these meridians, free these channels, free Route 83 or Ogden Avenue so the cars can pass through, because if the car can't pass through, that energy is stuck, stagnant, it's stuck, and we can't move it, right? So one way of helping moving everything forward is with the needles, the acupuncture.
Yeah, it sounds great. I know we have a lot of our people that are on our Facebook page that are interested in stuff that struggle. I know I struggle with it, and I know a lot of our friends do, and that's why I was asking that question. I have another one too. Do you ever deal with anybody with strokes?
Strokes. Stroke is a touchy one. It's a hard one. I've had a few in my career. I think that's an area that's really, really specialized. It deals with a lot of scalp acupuncture, meaning needling the scalp. I've had some training, but I'm going to be honest with you, I don't feel confident enough to say, yes, I'll take it on. I've had a few in the past, but that's one that I'm going to probably have to refer out or even co-manage.
Okay, that sounds great. It's just interesting because there's other things that people I know that are struggling with that.
Yeah.
But, do you deal with children a lot?
Children, yep, all ages. My youngest patient was a few minutes old.
Wow.
Yep. And my oldest and wisest was 98, and she passed a few years ago.
Wow, that's a long.
Yeah.
So do you work with kids that have ADHD and all that stuff? Do you think that acupuncture and chiropractor services will help with people with that?
Absolutely. I've had great success. Again, it's a compliance issue. We do a lot with the diet as well. We sit down with the parents of the child to see what is the problem. I have to get to know the family. I got to get to know the environment of the child. You know, is it under a stressful environment? Is the child taking a lot of medication? So that we have to really dig deep and see what these causes are, because the last thing I want to do is just do the shotgun approach. So I sit down, talk with the guardian, the parent guardian, because if we're dealing with the child, there's only so much the child can say, right? So when we start digging deep and finding the root cause and what's going on, then I can make the appropriate recommendations. So yes, Cliff Notes version, can chiropractic and acupuncture help? Absolutely. It can absolutely help.
Yeah, that's great to know, because a lot of parents are being told by their doctors to medicate these kids. And I just think that the medication is just being thrown around so much.
God.
Right away, oh, you're ADHD, here, take this, you know.
Right. Yeah. You know, I really think that's more common now since COVID hit, because everybody's locked inside. Well, has been locked inside until recently on the computers, right? Lack of interaction with other humans. I mean, we're human beings. We are meant to interact with people. We're meant to move. We're meant to interact. We're meant to laugh. We're meant to cry. We're not meant to be isolated in a room without the sun, without going outside in the yard, right? To play. Right? I mean, it's okay if the kid goes bike riding and falls off the bike, you know, that's okay. We want this movement. We want them to play, interact with kids, play soccer, right? Because I think a lot of that has taken a toll on the health of the children, psychologically speaking. They're much more stressed. And a lot of kids say, they come in, they say, I have headaches, I have low back pain, I can't concentrate. And then I see them even walking in the office, they're literally glued to their phone. I said, okay, step one, let's minimize the screen time. That's a huge culprit right there. Let's minimize our time on the screen, okay? And let's start interacting. Again, we want to be healthy. We want to make sure we don't have COVID, right? We want to take our necessary precautions. So we don't want to be around other people who are sick. So we got to use some common sense here. So bottom line here is that we are meant to interact with people. And the more isolated we are, the more depression we notice, the more aches and pains, right? So we got to break that cycle.
I think it's great, Angie. I think that your office deals with everything. And I think that's really important. And parents out there, you should really consider talking to Dr. Angie about your kids or your grandkids that have attention issues before you bring them to the regular doctor, because maybe this is a better avenue for them to go to. I know for a fact, you know, I had a daughter that had a lot of issues. And I think if I would have looked back and I would have started doing chiropractic stuff with her, she wouldn't have went through all the medication changes. Because a lot of these doctors use them as experiments.
Absolutely.
It's terrible. And they end up suffering. And I know a lot of you parents out there and grandparents, you understand what I'm talking about. So Dr. Angie's the way to go. So you should really look into her stuff. Now, Debbie, I'm going to send it over to you. I don't have any more questions.
Well, I'm just going to take a little wrap up here and say that I think that there isn't anything that you can't address, you know, and I think I really think that people should give it that, you know, I, as a hairdresser, had been at a seminar years and years ago, and the woman who got up and spoke, I vividly remember, she said, listen, everybody out there, you're standing on your feet. If your body is out of whack, if you don't take care of yourself, if you don't get, you know, adjusted and keep your body in line, your organs in your body are not going to perform the way that God intended it to, the way it's supposed to, you know. And so our bodies are so amazing. I honestly have to say that I think that we take advantage of them, and we don't you know, realize how we need to take care of them. You know, sometimes I take it for granted. That's what I'm trying to say.
Yes, absolutely.
You know, like, oh, I can eat that way, or I could do this, or I don't have to exercise, and I don't have to. But no, all those things do make an impact, you know. And so doing, you know, the route that you have there, I think is amazing. I just want everybody to know that we're going to actually have, you know, Dr. Angie put all her information on the bottom of the comments on this live. And then we're also going to ask her that if she will keep us updated. You know, she does some very cool Facebook Live like talks where she talks about certain subjects. One a couple weeks back was migraines. I mean, in this way, if you want to learn a little bit more about how she approaches things, you can kind of get to know her prior to making an appointment. It's kind of nice, you know, and then anything else that she can, you know, offer and give us. And since she's so local to the area that Lori and I are from, a lot of people here are from this area, but then you also maybe you moved away, but you have family members that are back here, you know, and you can, you know, share this information. It's going to go up on my YouTube. It's going to go on all the local stuff too. And with that, Laura, I'm going to have you do a closeout for us. And again, we really appreciate the time that you spent with us, Doctor.
Thank you.
We know
Thank you, Debbie.
We know it's between patients, and we appreciate how you did this. So
Yes,
with that, Laura, I'm
thank
going to give it to you.
Thank you so much, Dr. Angie. You were
Thank you, Lori.
so informative, and you're inspirational. So thank
you. I do want to say one quick comment. I do also speak Spanish as well. So I love helping people of all races, all ethnicities, right? English speaking, non-English speaking. You know, I was telling Lori and Debbie earlier that my first language was Greek, that I learned English, and then I continued Spanish. So I just truly love helping people. You know, and my biggest frustration is when I make the recommendations to the patients and I say, this is what you got to do, and they don't do it, they don't commit to care. It's like, that's like, you could do this. We could work on it together, you know? Right. But when the person doesn't want to help themselves, there's only so much I can do.
Right.
Yeah. Yeah.
That's awesome.
Well, with that, I just want to tell everybody, go out and be the best version of yourself. And
exactly.
And enjoy the sunshine if that's where it's at, where you're at. Enjoy your family, enjoy your life, and have a wonderful day. And thank you for joining us today.
All right.
Thank you,
everybody.
Thank you.
Take care.
Bye, Debbie.
Bye, guys. Bye. Thank you, Dr.